Today we're going to learn the Utrecht pattern for the left-handed surgeon. This pattern starts by backhanding the needle at about a 45-degree angle from your incision, going close to the incision to far from the incision. Your next bite, you'll hold the needle as you typically would and go from far to close. The Utrecht pattern is used typically in the uterus, and so that's why we change the orientation here, because in a large animal, this is going to be the easier way to close the uterus. The surgeon is going to pull the knot, or pull the ends parallel with the incision still to help bury your knot. Cut your suture in short, and then the entire pattern is going to be done four-handed here, where you're taking bites at about a 45-degree angle again from your incision. And just advancing as you're going. You're still not going through the incision, you're coming out adjacent to the incision like you are for the rest of the inverting patterns. And what that does is it helps create a nice seal. From where you came out, you're going to back your needle up just a little bit so that the pattern continues to advance and that you don't have a spot that leaks. Again, because this model is so thin, you're going to need to take full thickness bites through the model, but in a live patient, you typically wouldn't. When you pull this tight, you can see that most of the suture buries, so more similar to a Cushing's pattern than the Lambert pattern. And it kind of makes a nice looking baseball stitch, almost like the stitches on a baseball, especially in the live patient. Again, your 45 degrees are going from far to kind of close to your incision here. And when you're ready to end the pattern, you're going to take a bite straight from that. So you're kind of going the opposite angle that you were before. And that creates two ends of your loop that are near the incision. So essentially a deep loop, if you want to look at it that way. And then you're going to backhand the next one, and that goes from far to near. And that's going to give you a loop that's near and an end that's near to tie to. When you tie to those, that will help bury your knot and keep it deep in the incision. The surgeon's chosen to do a surgeon's throw here, which is fine, and is pulling parallel to the incision to bury that knot.